Buerger's disease is a rare disease of the arteries and veins in the arms and legs. In Buerger's disease, also called thromboangiitis obliterans, your blood vessels become swollen and can be blocked by blood clots, thrombi. This eventually damages or destroys the skin tissues and can lead to infection. Buerger's disease begins to show on your hands and feet and can eventually affect large areas of your arms and legs. Almost everyone diagnosed with Buerger's disease smokes cigarettes or uses other forms of tobacco, such as cigarettes. Quitting all forms of tobacco is the only way to eradicate Buerger's disease. For those who do not stop, amputation of one or more parts is sometimes necessary. Symptoms of Buerger's disease include decreased or numbness in the hands or feet, pale, red or blue hands or feet. The pain may go away in your legs and feet or in your hands and arms. This pain can occur when you use your hands or feet and reduce it when you stop the activity, specifying, or when you are resting. Inflammation near the vein under the skin, due to blood clots in the vein. Fingers and toes turning when exposed to cold, Raynaud's object. Open sores on your fingers and toes. When to see a doctor? See your doctor if you think you may have any signs or symptoms of Buerger's disease. The exact cause of Buerger's disease is unknown. Although tobacco use plays a significant role in the development of Buerger's disease, it is not clear how we do so. It is thought that the chemicals in tobacco can irritate the lining of your blood vessels, causing them to swell. Experts suspect that some people may have a genetic predisposition to the disease. It is also possible that the disease is caused by an autoimmune reaction when the immune system accidentally attacks healthy tissue. Risk factors: tobacco use. Smoking greatly increases your risk of Buerger's disease. But Buerger's disease can occur in people who use any form of tobacco, including tobacco and chewing tobacco. Smokers who smoked hand-smoked cigarettes use raw tobacco, and those who smoke more than half a pack of cigarettes a day could be at greater risk for Buerger's disease. Buerger's disease rate is very high in the Mediterranean, Middle East and Asia, where heavy smoking is very common. Chronic gum disease has long been linked to the development of Buerger's disease, although the reason for this link is not yet clear. Buerger's disease is more common in men than in women. However, this difference can be attributed to higher smoking rates in men. Age: the disease usually first appears in people under 45 years of age. Problems: when Buerger's condition worsens, blood flow to his arms and legs decreases. This is because of the blockage that makes it difficult for the blood to reach the tips of your fingers and toes. The bloodless tissue does not get the oxygen and nutrients it needs to survive. This can cause the skin and tissues at the ends of your fingers and toes to die, harmful. Signs and symptoms of injury include black or blue skin, loss of sensation in the affected fingers or toes, and bad breath from the affected area. Gangrene is a very serious condition that requires amputation of the affected finger or toe. Prevention: stop using tobacco in any way. Almost everyone with Buerger's disease has used tobacco in some way, a prominent cigarette. To prevent Buerger's disease, it is important not to use tobacco. Quitting smoking can be difficult. If you are like most smokers, you may have tried to quit in the past. It's never too late to try again. Talk to your doctor about strategies to help you quit.